some of what we're going through right now is grief. It's grief of the loss of a return to normalization. It's grief of the loss of where we hoped we would have been.
A doctor at Riley Hospital for Children is getting attention and support from across the country after he shared a photo of himself crying at work on Twitter. He says that healthcare workers' burnout is the worst that he's ever experienced. Good evening to you. I'm Alexis Rogers.
And I'm Phil Sanchez. Thank you for joining us tonight. News 8's Demi Johnson is live outside Riley. And Demi, his emotions were echoed by his colleagues today.
Yeah, earlier today, Riley Hospital for Children held a virtual meeting to be transparent about what hospitals are dealing with right now. Doctors on the call say this latest surge of COVID-19 is having a more serious impact on children. A picture is worth 1,000 words, but Dr. Adam Hill says he can sum this one up in just a few.
Distress and the exhaustion I'm seeing every day, my friends and colleagues in the hallways and in meeting rooms, something like I've never seen before.
The division chief of pediatric palliative care at Riley Hospital for Children is no stranger to being vulnerable on social media, but he says this tweet may be one of his most important.
You know, feeling the cumulative weight of the last year and a half and having rising apprehension and tension for what the coming weeks and months will once again hold in a new wave of this pandemic, especially one that will affect children in different and more serious ways, was this moment.
While he doesn't typically care for COVID patients, he still feels the effects of the virus. And doctors at Riley say with 70 positive cases in children in the past week, things are getting much worse.
The number of children that are hospitalized today has been the highest that we've had in several months. So several of these children are in the intensive care unit, so we know that they're quite sick, and some of these children have been transferred from other institutions.
It's put doctors in a bind. They say because hospitals across the country are short-staffed, they're caring for more patients with fewer resources.
We don't live in a bubble, right? We communicate with our colleagues around the country and around the world for that matter. And I've not seen it like this in the past, in terms of just folks are exhausted.
That's why Dr. Hill says the meaning behind his message holds a little more weight right now.
I try to normalize it in the way that it's okay to feel angry.
And he's hoping it provides an outlet to overcome.
Part of the tears that I shared is that then we have to find spaces to make sure we're working through that together so that we can hopefully continue to show up for the people who are in need.
Because of the increase in patients, doctors are asking parents to only bring your children to the emergency room for true emergencies. They say COVID-19 testing can be done at primary care doctors or even urgent care. Reporting in Indianapolis, Demi Johnson, Wish TV, wishtv.com, and follow us on Facebook.
Well, sobering stuff there. I want to bring in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams now. Doc, always good to see you as always.
Good to be here, but as you mentioned, very sobering news out there.
Yeah. So are we at a crisis level when it comes to pediatric hospitals in regards to COVID-19?
Well, we're not quite at a crisis level, but I'll give you some real numbers here. We usually have our highest number of pediatric ICU admissions in January because, again, you're having a lot of respiratory diseases, et cetera. You usually have your lowest month of admissions in August.
Right.
Our August admissions are surpassing those in January, and that's not just affecting our ability to care for COVID patients. That means if your child has a car accident, if your kid has cancer, if your kid has another reason that they need to be in the ICU, there may be no room in the inn.
That is scary stuff, speaking as a parent. What about nurses and doctors? Because last time around, obviously, they were overwhelmed, struggling also not only from a physical standpoint, but a mental standpoint as well. This time seems a little bit different, and it seems very emotional.
Well, it is, and I just left the hospital. I can tell you, nurses in particular are at a breaking point.
Yeah.
Because before they did what they had to do, knowing that there wasn't a vaccine available, knowing that there wasn't PPE out there. What's so frustrating for nurses and doctors now is knowing we have the tools to stop this virus and people are choosing not to. And they're getting particularly frustrated when someone comes in who's unvaccinated and then they have to stay late. They have to work extra hours, work extra days to take care of someone who could have prevented this from happening.
You can watch the full interview with Dr. Adams online at wishtv.com. You can also find it in the As Seen on Wish TV section.